Dopamine. It is a naturally occurring catecholamine neurotransmitter and an intravenous sympathomimetic drug. The ICU puzzle. A 65-year-old man with acute myocardial infarction is admitted to the ICU in cardiogenic shock. His blood pressure is 78/50 millimeters of mercury, urine output is falling, and his extremities are cold. The intensivist starts an intravenous infusion of dopamine. At a low infusion rate, his urine output improves. The infusion is increased, and now his heart pumps more forcefully with a rising cardiac output. Later, when his blood pressure remains critically low, the dose is increased again, and suddenly his blood pressure rises because his blood vessels constrict. How can the very same drug produce three completely different effects simply by changing the dose? The answer lies in dopamine's unique dose-dependent receptor activation. Mechanism of action. Dopamine is a dose-dependent adrenergic agonist, meaning its pharmacological effects change according to the infusion rate. At low doses, 1 to 3 micrograms per kilogram per minute, dopamine predominantly stimulates D1 receptors. These receptors cause vasodilation of the renal, mesenteric, and coronary vessels, resulting in increased renal blood flow and urine output. At moderate doses, 3 to 10 micrograms per kilogram per minute, dopamine primarily stimulates beta-1 receptors. This increases cardiac contractility and heart rate, leading to increased cardiac output. At high doses, above 10 micrograms per kilogram per minute, alpha-1 receptors become the dominant target. This produces vasoconstriction, which increases peripheral resistance and blood pressure. Remember the sequence. As the dose increases, dopamine progresses from D1 receptors to beta-1 receptors to alpha-1 receptors. Kidneys, heart, then blood vessels. Adverse effects. Let's begin with the cardiac adverse effects. Dopamine may cause tachycardia and arrhythmias due to beta-1 receptor stimulation, which increases heart rate and myocardial excitability. It can also precipitate angina because the increased cardiac contractility and heart rate raise myocardial oxygen demand, especially in patients with underlying coronary artery disease. Next are the vascular adverse effects. At high doses, alpha-1 receptor stimulation may cause excessive hypertension due to marked vasoconstriction. Another important complication is extravasation. If dopamine leaks outside the vein during intravenous infusion, it can produce intense local vasoconstriction, leading to tissue necrosis. Finally, there are other adverse effects, including nausea, vomiting, and headache, which are relatively less serious but may occur during therapy. Clinical uses. The primary indication is cardiogenic shock. Through beta-1 receptor stimulation, dopamine increases cardiac contractility and cardiac output, helping restore tissue perfusion in patients with severe pump failure, such as after an acute myocardial infarction. Dopamine may also be used in selected cases of septic shock, particularly when vasopressor support is needed. At higher doses, alpha-1 receptor stimulation produces vasoconstriction, increasing systemic vascular resistance and blood pressure. Another important indication is acute heart failure, especially in decompensated states with low cardiac output and hypotension. By improving myocardial contractility, dopamine helps support cardiac function until the underlying condition is stabilized. Finally, dopamine was previously used in acute renal failure because low doses increase renal blood flow and urine output through D1 receptor stimulation. However, it is no longer routinely recommended. Contraindication. The first important contraindication is pheochromocytoma. This catecholamine secreting tumor already produces excessive amounts of adrenaline and noradrenaline. Administering dopamine can further increase catecholamine activity, greatly increasing the risk of a hypertensive crisis. The second contraindication is uncorrected tachyarrhythmias. Dopamine has positive chronotropic effects, meaning it increases the heart rate through beta-1 receptor stimulation. In a patient who already has a rapid or unstable cardiac rhythm, dopamine can worsen the arrhythmia, increase myocardial oxygen demand, and further compromise cardiac function.